What are some of the myths about cervical cancer that you encounter in your practice?
Few of them will be the use of contraception. So some of them think family planning leads to the development of cervical cancer. So most of the time, they will come and tell you, even if you ask them to use contraception, they will come and tell you, this one asked me to use contraception, but from the streets of, I had, it causes this, it causes that. So you have to sit them down and then educate them. No, this is caused by an infection and not necessarily caused by the contraception that they're thinking, or which women are spreading in the streets that it's got. Some of them will also tell you the use of these sanitary pads contributes to what they develop later in life. So these are some of the myths that we usually encounter.
That is false,
That is false, yes. It is caused by an infection, and this infection can be eradicated, like Dr. Jite earlier said. Yes.
How can we address stigma and fear around both cancers? And I see Dr. Jite nodding her head. So for once, Dr. Roberts, I will start with her.
So those cancers, mainly the female cancers, breast cancer and cervical cancer, we celebrate them. We say celebrating breast cancer awareness. There's a reason for that. We wear pink, we come, we put balloons, we're celebrating because we want to encourage women. We know it's tough. Being told that you have cancer is one of the hardest things you can hear in your life. But we celebrate it so that we can encourage them. It's a way of encouraging them to come up and say, you know what, this is not as bad as it looks. If you come early, you can survive it. So definitely advocacy. The Global Breast Cancer Initiative by the WHO shows that there are 3 pillars. The pillar 1, 2, 3. Pillar 1 is advocacy, so people come on time. Pillar 2 is early detection and diagnosis. So within the time you present and say, I have a lump, in 2 months at least, you need to be confirmed whether it's cancer or not. So if you're there, you present, maybe your lump is 3 months ago, you present and you have not been confirmed, nobody told you whether it's cancer or not, and it has been 6 months, then you already missed out on pillar 2. So within 2 months of presentation, you should be diagnosed. You should be able to say, this is cancer, this is not cancer. If it's cancer, this is the way. If it's not, it's not cancer. So you're basically safe for now. So pillar 3 is comprehensive treatment. So all these pillars, they noticed that 20 countries in 20 years were able to reduce their mortality by 2%. So they studied this and realized that this is exactly what they did to be able to get this good statistics, meaning advocacy, 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 so they come on time. And when they come on time, we get them and diagnose them within 2 months. And when we diagnose them within 2 months, they have to go through comprehensive treatment in order to escape it and survive it. So the advocacy is basically, it's everything. Because even if you have early detection, early diagnosis and comprehensive treatment, you miss out on a lot. People can still survive it. Like with some people respond really well because chemotherapy too. Others respond well, others do not. But you miss out on a lot if you don't present on time. We can still catch it and diagnose it on time, and you go through comprehensive treatment for those that are really lucky. But you gain more time and more benefits because the treatment is less toxic for you because your cells are good. You're in a good spirit. So the advocacy is non-replaceable. You cannot replace that. Early detection, best treatment.
Same for you?
Yes. Yeah. Because of the sensitivity of the area that is affected, most women do not. Yes, they are not willing to come to the hospital, or they are not willing to tell their partners or their fellow women that this is what is happening to me. So they sit at home and wait until it's too late. It's either they cannot bear the bleeding anymore, or either the pain is just too much, or they are having this abnormal foul-smelling discharge that they cannot bear the scent anymore. That's the only time you will see them in the hospital. And also, if they come and then you screen them or you examine them and then tell them, this is what we found. Some of them are so afraid. Once they hear the word cancer, that's the end of it. Some of them will lose them. They don't come back again. So they decide to sit at home until God decide what is best. But most of them, we will not see them. So that is one of the main problems that we are encountering when it comes to the cervical cancer. These women also that have already gone into menopause, and they have not seen their period maybe for 2 years, 3 years, 4 years, 5 years, and then later they start bleeding again. So they also feel shy to maybe speak to their fellow women or speak to their children, and then, so they also wait until it's too late before they start talking about their symptoms, and by the time they arrive in the hospital, it's already too late. It's already too late.
And in terms of treatment options, Dr. Roberts, I mean, what options are available locally, and how accessible are they to, the average Gambian woman or woman resident in this country?
Okay. Just permit me, before I go on to that,
on
I just
stigma
wanted
and fear?
to add one other myth which can help in us helping the women with breast cancer, is that breast cancer is not contagious.
Okay.
If somebody has breast cancer, you cannot pass it on to somebody else.
That's good to know.
So, I mean, the people around the person with breast cancer, they have to be ready to support that person, because that person needs support. So don't think that if I come too close, I might catch breast cancer. It's not like that. Okay, so now going to the treatment options. Treatment, we have 3 main modalities for treatment. That's the surgery, the chemotherapy, that's the drugs, and then you have the radiotherapy. So surgery also, there are 2 main groups of surgery, where you have breast conserving surgery, meaning you don't take out the whole breast, and then you have mastectomy, meaning you take out the whole breast. So the breast conserving surgery usually goes together with radiotherapy. So when you take out the lump, then you irradiate that area to get rid of any residual tumor. And because we don't have radiotherapy here, we don't offer that type of surgery here. So we offer mastectomy, taking out the whole breast. And then we have the chemotherapy, the medications. Now some of the pharmacies are actually bringing in the medications. So we're able to get some of them locally. But a lot of them, we depend on donations to the hospital, or we ask the patients to go and get it from Senegal, which is the closest. They bring it, and then we're able to deliver it. Radiotherapy, like I said, we cannot offer that because we don't have that. Although I believe the ministry is in the process of trying to get radiotherapy in the country. So I'm not sure how far it is. I cannot say that, but I know that the process has started.
Well, we hope that it ends up with the technology being available. What about cervical cancer? Treatment options available, and how accessible are these two?
I can say it's the same. We have surgery, we have chemoradiation, and also immunotherapy. But the only one available in the country is surgery, and this one can only be done if the cancer is detected early. Once you come late, it's just unfortunate. We cannot do anything for you. The only thing we can do is write a medical report for you and then go for overseas treatment to do the chemoradiation. So, but we also have these other modalities that we can treat the precancerous lesions, and those modalities are available in the hospital. So once the precancerous lesions are detected, there are certain treatment modalities that we do for you, like the lip or the cryotherapy, yes, that we can do for you, and then get rid of the area where the precancerous lesions are, so that the other areas will be free.
Okay.
Yes.
And Dr. Jite, while patients are undergoing treatment, do they get emotional and psychological support? And how important is this kind of support?
They need it to survive it. Breast cancer the treatment is hard. That's just the honest truth. You're basically starting from somewhat feeling normal, and then you go downhill and then come back up. That's the way the treatment is. You start taking the drugs, you have a lot of side effects, nausea, vomiting, all sorts of, you can lose your hair, some people, all this goes away. The
that would
eyelashes.
Be at the radiotherapy stage.
Radio and chemo. Chemotherapy. The surgery basically is just to heal the wound, and then that's it. But the chemotherapy, because these are very powerful drugs, you go through a transformation. You come out different. That's what I always feel. Survivors come out different. They're no longer the person that went into that chemotherapy. They come out with a different mindset, with some insecurities sometimes. That's why the support is very, very, very important. You go through the chemo and then you radiotherapy or whatever else that you have to do. That is treatment phase. You are treating your, you know that you're sick at this moment and you're receiving treatment. Coming out of it is even another hard part, because the community, the support community now has gone away, because now you're done with treatment. So you're left alone with trying to grow back your hair. You're left alone with all the insecurity. Some people don't know. They'll be like, oh, you've changed. Those things just stab you in the chest. So it's so difficult. The survivorship is not just during the treatment. The community support usually is there when somebody, they're in hiding. That helps a bit. But coming out, now treatment is over, now what? That's another tough part to deal with, especially the first 2 years. You might look different, you might have lost one breast, you were trying to gain back your confidence, you're trying to fit back into society. But some people get it, some people don't get it. It's so difficult to manage somebody who's surviving, because every little thing can be held against you. So that is a gap that is still there. We still don't have a survivorship clinic, sort of, and that's one of the things that we are trying to work on, to that transition there. Sometimes they don't know when they need to do a follow-up, who do they need to talk to if they have a concern. They have so many questions and there's nobody there to answer it. So you can do a surgery, do the chemotherapy, and the doctors are there to answer, but after the treatment, are you going to go back to it's difficult. That gap there is still empty, and that's where we are trying to focus on now, to see, because now we do have survivors actually. We do have survivors in this country, and one thing they have in common is they all came on time. Come on time, and then we tell you what we have here. What we don't have, then we coordinate the treatment outside. We write letters for you. We say, go here, get it done, and then come back. Yeah.
And if the right kind of emotional and psychological support is available at EFSTH, how do you prepare, close family members to continue this support after the patient is discharged from the hospital? Dr. Roberts.
Well, I think that's what Dr. Jita is saying. That there's a gap there. I mean, we are physicians and surgeons. We treat them, and then after we treat them, yes, we give them regular follow-ups. We follow up the wound, trying to see whether there's any recurrence or any breast cancer on the other side, and we encourage them to be doing examination themselves on the other side, or the other breast, because one of the risk factors of breast cancer is also previous history of breast cancer. So if I've had breast cancer on the right side, there's a higher chance I'm at a higher risk of having breast cancer on the other side. So we just encourage them. We try to give them support as we can as a hospital. But what she's saying is that it also needs to go beyond the hospital to the community.
And you can't help, close family members to
yes, we can talk to them, but we cannot extend that help to the family members and the community.
Okay.
So I guess maybe we should be advocating for Breast Cancer Survival Association or something like that. Then that one will be able to provide that support that they need.
What about Dr. Jaju in the case of cervical cancer? Yes.
Yes, I can say it's the same for us too. But because of the psychosocial issue that they go through, the vaginal bleeding that they're having, the abnormal scent that is coming through them, so they find it difficult to associate themselves socially. So they are always in a hideout, and that will contribute more to their deterioration, because you're not talking to people, you're not socially attached to people. So you're just sitting in your corner. So that alone is a psychological trauma together with the condition that you're going through. So it's not helping. So I think we need to advocate for having where we can have our own clinic, where we can have survivors, or even if they are under treatment, where we can send them so that they will have that psychological support.
We have less than 10 minutes remaining. What can the health authorities and partners, the government and partners do to improve cancer awareness in the Gambia?
Uncle Peter, it takes a village to raise a child, but it also takes a village to help somebody diagnosed with cancer to survive it. And that's why each year, with limited resources, we try to organize free screenings, free mass breast and cervical cancer screenings, so that women can come and then they can get screened for free. We try to provide funding. We knock on doors. To get funding for the event. We try to do a breast ultrasound. We screen. We do all the tests, at least to diagnosis. That's a big shunt. It's like lifting somebody from not knowing what they have to diagnosis in a space of a month. That is amazing. The mass breast cancer screenings should be supported. And I think partners should come on board. When we knock, we are not begging. It's not going into our pockets. Some of us don't even have pockets. That's how tough it is. But when we come and knock and say we need funding for this, if as an institution you have something, give it out. It's going to help in raising the awareness. Someone might not come to the screening, but they might hear about the screening and then do something and come on another day. When we come, we knock and ask for funding for this event, which we have on the 25th and 26th of this month.
We'll talk more about that. Yes. Just in closing. I know you're in a hurry to talk about
yes. That's it, partners. And you're a partner as well. The media is a very big partner. We do this all year round. We talk to patients one-on-one, but this is basically talking to thousands of people at a time. And some of them are in corporate institutions, some of them are home, some of them are with survivors, some of them have this condition. So the partnership for the goals, like we say, SDG 17, is very important in this. When partners come on board, they try to you can help when you have a media platform. And I'm so happy that you're going to do this every Monday, because a partner came on board and decided to sponsor it. So the partnership for the goals cannot be overlooked. It takes a village to fight this. And you think one day it's another person this is affecting, but this is 1 out of 8 women. 1 out of 8 women. That's pretty scary. This is going to touch every family in this country.
Exactly.
If it's not touching your direct family member, it's going to touch your neighbor right there, because it's 1 out of 8. The statistics will not skip your house. So you support today, and we're able to build structures. We're able to do with the little we have. It's going to benefit you in the long run.
And I'll eliminate Dr. Roberts, on this question. How can men be involved in supporting breast cancer and cervical cancer awareness and prevention?
Yes,
let's start with Dr. Jai.
I think men can do a lot for us.
Martin, I hope you're listening. The cameraman.
Yes, because most of them do not like accompanying their partners to the hospital. They always stay behind, saying they're working, they're getting something for the family. But it's also important. It's not only about the money. The social support, the physical support, and all those things are very, very important. So it's always very important to just sit one day and then say, in fact, encourage your women and then tell them, why don't you think you are experiencing disorders? Because some women will be reluctant to come to the hospital. We had this, and then you said you were experiencing this. What do you think? Let's go to the hospital and then do some checkups and all those things. So they can support in so many ways, and also the finance. So women are facing a lot of difficulties in getting the money because health is not free. Health is not free. You come to the hospital, even the screening, you have to pay for it. Some of them will come and then we want to do certain screening for them, and they will tell you they don't have the money. And some of them we do our best to make sure that we don't lose them. So those things are important. I think men should come up by accompanying their ladies and also giving the financial support to their women, so that at least their health, they will take care of their health.
Well, I'm not sure about the financial support, but Dr. Roberts has done well in accompanying both of you to the studio. Well done, Dr. Roberts. And Dr. Gite?
Yeah, so I was just gonna
men's involvement.
I was just gonna add on to something you just started saying. Dr. Roberts has been in this breast cancer fight since I was a medical student, like year 1 and 2. He's been there. He was the one taking care of these breast cancer patients. You also have Dr. Jete, you have Dr. Sanyan that are, advocates for this breast cancer, and yourself, you are an advocate. Well, this show is an advocacy for breast cancer.
I have 3 children. They're all girls.
Yes. Wow. So men can play a huge role in And when we knock the doors and the managing director is a man, and then you say, okay, this is important, this is women's health, it's important. That's a way of supporting. And she alluded, the husbands, they have a big role, because if a woman has cervical cancer or breast cancer and then you avoid her, that's the end of her self-confidence. She's counting on you to be there for her. If you avoid her, and sometimes I know I've seen patients where they get special rooms for them, so that they and their children can be there and take care of the men. Just sometimes they don't know what to do too. You can't blame them all the time. But isolating yourself and not providing the right support the woman needs will break her faster than the cancer.
Yes, and some of them are abandoned, and other men will go and then marry someone else.
That should be criminalized.
Yes.
That should be criminalized. Okay, let's end on, for you, the main thing, the Pink October activity coming up, and let's welcome back Dr. Roberts.
Yes, thank you very much. So we've decided as a teaching hospital to leave it for the last weekend of this month, so that if during all the other screenings they've had any issues, they can come to the teaching hospital. That's on the 25th and 26th. We're doing both cervical and breast cancer screening, free of charge. You're not going to pay anything. Although, we're raising funds to subsidize the investigations and things you would need to do in the hospital. So you yourself won't have to pay anything. So we're encouraging all the women to come out and get themselves screened, and so that they know where they stand at this time. And we also like to encourage people to do the self-breast exam. During this screening, there will be some people who will be teaching women how to do the self-breast exam, so that you know how to do it, so that you get familiar with your own breast and be able to detect these things early. Because like we're all singing, early detection will save a life. So we are encouraging all women to come out for this screening exercise.
If you say you're raising funds for whatever reason, how will you raise funds if people come and don't pay anything?
Yeah, that's what I'm saying. So we're raising funds so that people don't pay anything when they
come. Okay. Yes. Okay. I thought you were trying to raise funds with this event.
No.
For which you're not charging anything.
No. We're trying to raise funds so that when people come, they don't have to pay anything.
Okay.
Because one misunderstanding that people have in the Gambia is that health is free. Health is never free. Somebody has to pay for it. So that's why we're raising funds, so that we can do this screening free, so that you know where you stand, and then you can start following up for whatever treatment that needs to be done.
Okay. And Dr. Jaju, will we also be screening for?
Yes, we will also be doing the screening for cervical cancer. So I am encouraging all women to come in and then participate, please.
Okay.
Yes.
All right. Remind us of the dates again, Dr. Gite.
25th and 26th of October. That's the last Saturday and Sunday of this month. We're going to be having a free breast cancer and cervical screening at the Edward Francis Small Teaching Hospital around the pediatric. That's the SOPD, the pediatric hospital, SOPD.
And then the gynae clinic.
All right.
Yeah.
Dr.
So
Gite,
we also encourage them to come for follow-ups. This is the main issue we have with them.
Okay.
Some of them can come for screening the first day. If you ask them to come again, that's the end of it. They don't come.
All right. Dr. Jaju, Dr. Gite, Dr. Roberts, thank you very much for your time this morning, and we'd like to thank Comium for sponsoring West Coast Radio's coverage of Pink October this year.
Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
Axel jam si way.
Yo apply, yo luta do dede. Luta mo nulo jël moto nga andil ma xaalis. Hello? Ano lay waxal?
Bisul mu fay.
What?
Bisul mu fine.
Oh. Yes!
Wave Axina Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave. Bisul mu fine? Wave. Your money is yours.